Good morning, ladies and gentlemen. Welcome to week three of this course on physical medicine rehabilitation in sports. This is lecture one of week three, and here we will discuss acute sports injuries and the injury assessment protocol. I will be covering this topic as per the following outline: introduction, classification of sports injuries, causes and types of sports injuries, clinical features, the various protocols which are used in the assessment and the management of sports injuries, advances and future trends in assessment and management, and as usual, we will conclude with a take home message. Acute sports injuries generally occur suddenly due to trauma, and immediate assessment is crucial for the effective management and faster recovery. If you have a structured injury assessment protocol, you can generally deliver a better standard of care. Otherwise, everything will be very haphazard. How do you classify the sports injuries? Sports injuries may be classified as acute injuries, which is injuries of sudden onset due to internal or external forces, such as fractures, sprains, strains, contusions, etc. Sports injuries may be chronic or repetitive stress injuries which develop over time due to repetitive stress. For example, tendinopathy, stress fractures, etc. Sports injuries may be contact injuries. They result from collisions or direct blows. And they may be non contact injuries which occur without external impact, often due to biomechanical issues. The common causes of acute sports injuries are direct trauma from an external impact, for example, tackles, falls, collisions, etc. Indirect trauma, it may be due to an excessive force which causes a ligament or muscle to tear, for example, a sudden change in direction during the game. It may be overuse, which may lead to acute episodes, what is called as acute on chronic injury. A sudden pain or injury due to an accumulated stress. For example, if the individual has a stress fracture, it has suddenly progressed to a complete fracture due to the game or due to the injury. There are different types of acute sports injuries: sprains, which are ligament damage due to excessive stretching or tearing; strains, muscle or tendon injuries caused by overextension; fractures, partial or complete break in the bones due to impact; dislocations or subluxations, when the joints are forced out of normal alignment. If the disalignment is complete, it is a dislocation. If the disalignment is partial, that means the articular surfaces are still in contact with each other, it's called a subluxation. Contusion. It may be caused by bruising caused by a direct impact. We have discussed this biomechanics of acute injuries in a previous lecture. I'll just summarize it. We should understand the forces that may cause injury. It may be a compressive force, it may be torsion, or it may be shear. We should also remember that all tissues have something called a load tolerance, or they have a capacity to withstand a force up to a particular limit. If the force is beyond this limit, the tissue will tear. There is something called kinetic chain concept, which we have discussed it in previous lectures. So it is basically how different body segments are interconnected to each other, and they may contribute to injury risk. And one segment anywhere in the body may contribute to an injury risk in another segment elsewhere in the body. Let's talk about the signs and symptoms of acute injuries. First and foremost, there will be pain and tenderness at the injury site. There will be swelling, there will be bruising, and there may be deformity. There will be definite reduced range of motion and reduction in strength, possibly due to pain or due to dislocation, subluxation, etc. The patient may display inability to bear weight or to perform normal movements. Any of these, you must presume that there is an injury and take action accordingly. What is the importance of this immediate injury assessment? First and foremost, it prevents further damage. It helps to determine how severe is this injury and how to progress with the necessary treatment. It also aids in return to play decisions and in rehabilitation planning. When we come on to field for an injury, we have to do something called an on-field assessment or primary survey. This is called Dr. ABC protocol. Danger. We have to ensure a safe environment on the field. If it is not safe, then we have to move the athlete to a safer area. Response. Check the athlete's level of consciousness, whether he is fully conscious, whether he responds to pain, whether he is semi-conscious, or whether he is unconscious. Check the airway for any obstructions. If you feel there is any obstructions in the airway, try and open the airway. The most common method in the absence of a suspected cervical injury is a head tilt chin lift method. By this, you will be able to open the airway and the patient may be able to start breathing. If you are suspecting a cervical spine injury, then do not use the head tilt chin lift method. Then you will use something called a jaw thrust and you will pull the jaw forward. This will also open the airway and you may be able to improve the breathing. Once you have assessed the airway, check for breathing. Ensure that the patient is breathing normally. After airway breathing, check for circulation. Check the pulse and check for any bleeding. Pulse is okay, there is no bleeding, patient is fine. If pulse is feeble or low volume, check for bleeding and arrest the bleeding. Once you're finished with your Dr. ABC protocol, try and identify any life-threatening conditions. Once you're finished with your primary survey, we should go ahead with something called the secondary survey. It consists of a detailed assessment using the HOPS protocol. Start with a detailed history taking about the mechanism of injury, the symptoms, and the past injuries. Try not to go into detailed family history or other histories because that is not relevant at this time. Try and restrict it to the immediate history. What happened? How did it happen? And did anybody witness the injury? Observation. Observe the injured part for any swelling, dislocation, deformities, surgical scars, etc. Palpation. Palpate the affected part, identify any pain points, identify any structural damage, and look for joint integrity and congruity. Once you finish history, observation, and palpation, proceed to special or functional testing. Start by checking the range of motion, the strength, and the stability. There is something called the SALTAPS algorithm for dealing with an acute sports injuries. So number one, stop play immediately. Ask the athlete about pain and symptoms. Look for swelling, deformity, and discoloration. Touch and palpate for pain and tenderness. Do the active movements by the athlete. Once the active movements tests are done, go for passive movement tests by the examiner. And finally, do the strength testing to determine functional capacity. Once we're finished with the assessment, you go for management. We start with something called PRICE protocol. PRICE stands for protection to prevent further injuries, rest to limit movement of the affected area, ice to reduce pain and swelling, compression to control swelling and stabilize the injury, and elevation to reduce blood pooling and swelling. Nowadays, we are dealing with something called the police principle, which is an updated approach. Police stands for protection of the affected part, optimal loading. That means they say nowadays encourage gradual movement instead of complete rest. Then ice, compression, and elevation as in PRICE protocol. This protocol encourages control movement to aid recovery. There is a very big role of imaging in injury assessment. We use X-rays to detect fractures and dislocations. We use MRI to identify soft tissue injuries to ligaments, tendons, cartilage, muscles, etc. We use ultrasound to evaluate muscle and tendon damage. Ultrasound is also important to assess real-time movement and any damage to the tendons during the movement. CT scans are used for complex fractures and joint injuries. When we are dealing with acute injury assessment and management, we should be aware of something called red flags. Intense pain or loss of function of a body part, deformity or open wounds, numbness or loss of sensation, and signs of concussion such as dizziness, confusion, and loss of consciousness. If you see any of these red flag signs, the patient should immediately be removed from the playing field and moved to a hospital for further medical evaluation. Management of specific acute injuries. So, if you're suspecting or diagnosing a sprain or a strain, treatment is RISE, rehabilitation, and therapeutic exercises. If you're suspecting a fracture, immobilization, and surgery if needed. If you're suspecting a dislocation, reduction and stabilization. If you're suspecting a contusion, compression, ice, and protection. We should be aware of concussion assessment and management. It is very important because head injury, whiplash injury, head impacts are very common in sport. We should be aware of the mechanism of concussions and, if possible, try and get video of the incident so that you can be sure what is the type of impact, whether it is a direct impact, whether it is an indirect impact, whether it is a whiplash motion, etc. The SCAT-6 assessment tool for concussion evaluation, Sports Concussion Assessment Tool 6, is a very important tool for concussion assessment. However, it is always better if the SCAT-6 has been done prior to the game by all the athletes so that you have a baseline data. And when administer the SCAT-6 post the concussion or suspected concussion, you have something to compare it with. Once the concussion assessment and management has been done, you have to encourage a gradual return to play protocol. We should not encourage return to play if the symptoms of the first concussion have not been resolved. Because if you encourage it and the individual gets another head injury, this is called sudden second impact syndrome and the individual may die. Emergency care for severe injuries. Make sure you handle spinal injuries safely. Always suspect spine injuries and cervical spine injuries in trauma and put a cervical collar as the first step of assessment and management. And make sure the individual is immobilized on a spinal board. You should be aware of how to manage open fractures and severe bleeding. And all the people involved in the sports event should be trained in cardiopulmonary resuscitation for cardiac emergencies. Nowadays, the consensus worldwide is in case of sudden cardiac emergencies, bystander CPR is life saving. Bystander means anybody who's standing near the afflicted individual. Return to play decision making. There are several criteria for safe return to play: pain free range of motion, full range of motion, and strength within 90% of the other unaffected limb. The individual must be functionally tested and sport specific assessments must be completed. And there are a lot of risks to premature return and re injury. What is the role of sports medicine professionals? They are team physicians. Sports physiotherapists can act as team physiotherapists, and athletic trainers will act as SNC and first aid professionals. They do injury assessment, they do rehabilitation, and they do prevention. They also have a big role in educating athletes for self care and injury prevention. Injury prevention strategies. We must stress upon the importance of warm ups and cool down. We must have a detailed strength and conditioning program prior to the start of the season. And any errors must be picked up before the season, and sport specific biomechanical corrections should be integrated into the training program. There is a big psychological impact of acute injuries, and the athlete has a strong emotional response to the injuries, and we should be aware of this and we should be able to manage it. We should be able to teach them mental strategies for coping with injury and rehabilitation. If we are unable to do so, please take the help of a sports psychologist. And there is a big role of sports psychologists in recovery. Advances in acute injury management. Regenerative medicine is coming in a big way with platelet rich plasma and stem cell therapy. There is a big role of wearable technology for injury monitoring as well as for assessing the force of impact on the human body. Artificial intelligence assisted injury risk prediction is coming into a big way, and for this we have to have a proper injury database. What are the future trends in injury assessment and management? Telemedicine is coming in a big way in sports injury care. And nowadays, with telemedicine, you can speak with a specialist sitting elsewhere or in another city about the condition on the field of the athlete and get advice on how to manage the athlete better. Virtual reality for rehabilitation is a very important tool which can help in faster rehabilitation and recovery. And machine learning tools are being used in injury prediction. Now, let's come back to the take home message. Acute sports injuries are sprains, fractures, contusions, dislocations, etc. The injury assessment protocol includes primary and secondary evaluations. The primary evaluations are done to detect life threatening conditions, and the secondary evaluation is done to detect a detailed physical evaluation. The immediate management consists of the PRICE protocol and the police protocol. The key assessment tools are the SALTAPS method, the SCAT6 for concussion evaluation, X rays, MRI, CT, local ultrasound, etc. When you are dealing with sports emergencies, please be aware of the red flags which are there. And if you find any red flags, make sure the athlete is transported to a higher center for management and detailed medical evaluation. If you find a red flag, please do not return the athlete to play. There is a strict return to play criteria for several sports, and we must be following them strictly. We must not come under pressure by the coach, by the management, or by the crowds and return an athlete to play when he is in no fit condition to do so. The future trends in sports injury management are artificial injury based injury predictions, regenerative medicine, wearable injury monitoring, etc. These are the references, ladies and gentlemen. I strongly urge you to go through them in the interest of better understanding. I seem to have finished, ladies and gentlemen. Thank you for your patience. Thank you for being along so long with this course, and Jai Hind.